Hello everyone, good morning. My name is Radha and I did this presentation on urinary tract infection. So let's get started. So we will talk about our patient. We'll talk about the symptoms and any relevant history that she has to the case. We'll also discuss the physical findings, her diagnosis and any diagnostic testing, as well as her treatment plan. So let's meet our patient. So our patient Casey is a 23-year-old female student who presents to the campus student health clinic with a chief complaints of increasing urinary frequency, along with urgency and dysuria for approximately 4 days. Over the next 12 hours, these symptoms persist in addition to a burning sensation when urinating. Upon further evaluation, the patient has no previous history of similar complaints. However, she has recently become sexually active and has been using a diaphragm with spermicide. She denies any allergies. For past medical history, she has no history of diabetes, TB, or hypertension. All of her childhood immunizations are up to date. She denies any past medical history. She is not on any medications. For family history are not significant to our case at the moment. Her social history, she has no history of addiction and she is a non-smoker. For the diet, she is a vegetarian. For a physical exam, except for the slight low-grade fever, her vitals are normal. Her temperature is 99. Her blood pressure is 108/54. Respiratory rate of 18 per minute. And heart rate is 22 beats per minute. She's setting 99% on room air currently. For her general appearance, patient is in no apparent distress. She's awake, alert, and oriented ×4, answers questions appropriately, and is well groomed. For clinical presentations, upon examination, she denied any feelings of feverish prior to coming in today, no chills, no nausea or vomiting, and denies any back pain. She reported that she did not feel particularly sick and stated that she was not pregnant. So UTI is being diagnosed based on one symptoms, if it's complicated versus uncomplicated UTI, based on their presenting symptoms, their past medical history, as well as risk factors. In her case, her age is a risk factor. The fact that she is sexually active and using spermicide for the condom and the diaphragm. For the diagnostic testing, the uncontaminated midstream urine sample is used, which is used because it reduces the contamination, having cleansed the genitalia prior to us collecting the urine sample. We also do microscopic examination of the urine also. For the urinalysis, we can see the presence of pus, white blood cells, red blood cells. If the bacteria count is greater than 10 to the greater 5 power, that just shows it's a significant bacteria. For the leukocyte esterase dipstick test, it'll show that white blood cells is in the urine. The normal value for the urine is less than 10 white cells per cubic of urine, millimeters of urine. Anything higher than that would suggest an infection. We'd also collect the urine culture. We'll do imaging techniques such as CT scan and MRI. For the lab findings, for someone who has a UTI, they would have the following results. Their pH would be on the alkaline side, which is the perfect scenario for bacteria to grow is in an alkaline environment. The urine appearance would be cloudy. The color would be deep amber. The odor would have this foul smell to it, or like a distinct smell. There might be blood present in the urine. The leukocyte esterase will be present, as well as white blood count, and the bacteria, which goes by the number of bacteria in a colony forming unit. For the treatment, the goal of therapy really for the UTI treatment is to eliminate any infection, and to also relieve any acute symptoms and prevent any recurrence or possible long-term complications that might occur from this infection. With symptomatic UTI, we would use an antibiotic therapy, which is as follows. We can prescribe a single dose, which Bactrim, azacloftab, and amoxicillin, ciprofloxacin are all part of that single dose, which the patient just takes one pill. There is a 3-day course, and the efficacy of the 3-day course is the same as the 7-day therapy, but it has fewer adverse effects. These meds would include the beta-lactam antibiotics, DMP, SMZ, and extended release ciprofloxacin. The 7-day course is really used for patients who have recurrent cases of UTI, patients who are pregnant, or their UTI is presenting with other risk factors. That's 10 to 14-day course is really used for the complicated UTI, or individuals who have a high risk of mortality and morbidity. Asymptomatic UTI, we wouldn't really prescribe antibiotics. There's no treatment required for it except in special situations. With someone who has repetitive chronic UTIs, we would just put them on a prophylactic antibiotics. For non-specific therapy, we would teach our patients to really drink more water, about 6 to 8 cups a day. They would maintain their acidity of urine by the fluids, such as cranberry juice. Just to be aware that there are certain cranberry juices who have high sugar level that would really defeat the purpose of drinking the cranberry juice. There's also cranberry juice, cranberry pills that they can take. For someone who is on antibiotic, especially who is taking antibiotics for the first time, or someone who has an extensive list of allergies to antibiotics, we would really want to teach them that sometimes they might get Steve Johnson syndrome or might get dermatitis, angioedema is another side effect or adverse effect rather, GI disturbances, agranulocytosis, renal dysfunction, antibiotic-associated colitis, lethargy, peripheral neuropathy, rhabdo, especially with someone who's taken ciprofloxacin. So it's really important to really teach our patients about the side effects and what to expect, whatever antibiotics they are going to be on. These are my references. Thank you so much for listening to my presentation. I hope you guys learned a lot and enjoyed listening. Thank you so much.